Hi, I'm Eric Fontaine. I'm a physical therapist here at Hands on Healing in Bethlehem, and today I'm going to talk to you a little bit about prehab. So, what is prehab? Well, prehab is a course of rehabilitation commonly scheduled prior to surgery, and it's most commonly scheduled in patients who are going to be undergoing like a joint replacement surgery, such as a knee replacement or a hip replacement. And the intent of the prehab is to try to prepare that surgical region as much as possible before the surgery. So for instance, after a knee replacement, the muscles around the knee often become weakened and tight just due to the trauma associated with putting in the replacement. They cut a big hole in your leg, so things are going to be pretty wound up afterwards. So this is problematic because after the surgery, you want to have really strong muscles to improve how the joint moves. It helps to relieve pain, and it just improves how a person walks and does their normal daily activities. So since strength and range of motion are expected to be reduced after the surgery, maximizing these factors before the surgery helps these patients progress faster and stay safer afterwards. So prehab is kind of an essential part of preparing for the surgery. In addition, there's a lot of education that goes on before the surgery, and a lot of that happens during the prehab process. So patients often learn what to expect for the rehab after the surgery, and they can kind of ask questions to help them become more mentally prepared for a major procedure. Additionally, a lot of times we go over how to use canes and walkers, so learning how to use these devices isn't as much of a shock. And finally, there is some evidence that prehab may reduce hospital stay time immediately after the surgery. And that can be a really good thing because the patients are able to more independently stand and walk on their own due to their improved conditioning. So ultimately, think of prehab as kind of like prep work for the surgery. If your surgery and like the subsequent rehabilitation were a test, prehab would kind of be the studying beforehand to ensure that you pass the test. So in a lot of cases, the extra work initially goes a long way, and you'll likely be happy that you were prepared. The big thing is that every prehab is a little bit different depending on how you present before the surgery. And so we kind of work to tailor each program to each individual to really help them get the most out of it and really prepare for the surgery. So that's kind of what prehab is. If you have any other questions or concerns, or maybe you're trying to schedule for prehab or something like that, definitely feel free to call a Hands on Healing or Access group, and we'd be more than happy to talk to you and help you find out more about this process. Thanks, everyone.